Hi, and welcome to The Other Side. Before we reveal to you the #1 reason why many of those other therapies can't relieve your jaw pain, we should probably tell you who we are.
My name is Dr. Harry Kunelis. I am a neuromuscular dentist in the Chicagoland area. Along with our general dental services that we provide, I also have a special interest in chronic pain and TMD related issues.
And I'm John Heyer. I'm a holistic chiropractor, also practicing in the Chicagoland area. And along with our general services, I also have a specific focus on TMD, or in other words, head, neck, and jaw pain. And you know, Doc, we really get a lot of challenging cases that come into our office, and we've worked on those together. And sometimes those are cases that a lot of other doctors don't really look forward to working with. Either A, they don't get good results, or B, they really don't know how to approach it and treat it, and we get those challenging people. It's not unusual for a patient to walk into our office who's seen 5, 6, 10 different doctors. I remember one young girl had seen 25 other doctors before she came to me. But I don't know if our audience really fully understands what is TMD and how big of a problem this is.
Absolutely, Dr. Heyer. Currently, the Journal of American Dental Association estimates that 40 million Americans over the age of 18 years old have suffered from some form of oral facial pain or TMD over the last 6 months. And in addition to that, other literature is stating that there are approximately 7 million working days per year lost due to these chronic headache-related issues. And that's not even accounting for some of the lower back and other body part injuries that are leading to job-related days off work as well. So as we can easily see now that this is no longer an individual problem, but society's problem as well.
7 million days lost due to headaches alone, and that's probably not all of it, because I'm sure some people are self-medicating on their own. And maybe you're one of them. Maybe you are experiencing headaches or neck pain or jaw pain. And let me ask you this, what is it costing you? What is it costing you in time? Either running to the doctor's office or taking time off of work. What is it costing you in money? Doctor's office visits aren't getting cheaper, and if you're not working, you're not collecting an income. What is this costing you in relationships? I don't know about you, but when I'm in pain, I'm not always pleasant to be around, and my family avoids me. Is that you? Well, like I said, we do get these challenging and complex cases, and you know, you may be thinking, I've already been to a dentist, or you've already tried a chiropractor, or you've tried physical therapy, or a neurologist, or what have you. Why would, you know, what is my next hope? Well, are you ready for the #1 secret? The #1 reason why many of these therapies don't work is because they don't do a holistic, unified co-management treatment of the patient. We have a chirodental approach to helping a patient in a holistic manner. Doc, why don't you share that?
Sure, Dr. Heyer. I agree with Dr. Heyer 100% in that the #1 secret to generating efficient results consistently over time is the co-management of cases, where a chiropractor and a dentist with specialized training in these sorts of disorders can come together with one message and one philosophy. And ultimately, in today's day and age, with medicine being as diverse as it is, it's very difficult to find a group of providers that are abiding by one philosophy with the same message, and as a result, the patient suffers. In our chirodental approach, because our philosophies are so aligned, we are able to have treatment of the spine as well as treatment of the jaw taking place at exactly the same time, and that's just what the human body requires in these complex cases.
Now, why don't you share a case with the audience?
One case that comes specifically to mind is of a 20-year-old young man who actually was in a car accident at the age of 18. For 2 years suffered from severe headaches and actually admitted to having these headaches feel like they were a vice grip. In other words, they felt as if his head was in the middle of a vice and the vice was being squeezed on his head. For those 2 years, the only therapy that had worked for this young man was 21 Botox injections in his face. And the 21 Botox injections worked, but he always admitted that they only lasted for about 3 to 4 months. Once Dr. Heyer and I started our co-treatment, our chirodental approach, we were able not only to get rid of any need for medications and any need for further Botox, we were able to eliminate his pain completely, as well as no longer needing the dental requirement or the chiropractic requirement to the degree that it needed when he was in pain originally. So that's our ultimate goal, is to get to a point where we can stabilize the condition, stabilize the structures, to where there are no alternative medicine or alternative therapies required to maintain this condition moving forward. And I know Dr. Hires worked on several cases on his own and many more with myself that he's probably had similar results that he'll be able to share with you as well.
Yeah, one that comes to mind right off the top of my head is a young lady of 26 with 3 children, and quite an interesting lady. She's a cancer survivor. She has fibromyalgia, among a number of other health issues, severe migraines, severe headaches, neck pain, and jaw pain, and severe to the point where many times when she would come into the office, we'd have to turn the lights out because she was crying. She couldn't handle it. She was in so much pain. Well, after our treatment, our chiropractic dental approach, she is without headaches. And actually, I know she's doing very well because I know her from social circles, and we haven't seen her clinically in quite some time. And we helped her, and I feel very strongly that we can help you as well. If you're still sitting there in pain, and maybe you've tried those other methods, you've tried those other therapies, if you're still living with the pain, you owe it to yourself to try another approach. We would like to invite you to a presentation we're giving in the near future. On your computer screen, you're going to see a time, a date, and a location for our next presentation. And we'd like to invite you, no obligation, to come and hear what our presentation is about. Give you an opportunity to see and understand more of what we do, and it would also give us an opportunity to meet you and see if you're a good candidate for our program. We don't accept everybody, but I guarantee you, if we do accept your case, we will bend over backwards to bring you satisfaction. Thank you. We'll see you there.